Welcome to Integrity Linguistics Institute. Now, let's read the very first question. When disclosing distressing information to patients, staff must avoid option A, the temptation to use simplistic language, B, directing their attention at family members, C, any approach which leads to misunderstandings. So that was the very first question as well as the answer options. Now we have actually translated them into Indian languages. So it is easier for Indian candidates. So if at all required, kindly pause the video and go through them to make it more understandable. Now we are going to do the keyword analysis of the question. So let's identify the keywords. When disclosing, that is when breaking or when sharing distressing information to patients, staff must avoid. Okay, so these are the keywords. Distressing information, the staff must avoid something. Now, let's do the keyword analysis of option A. The temptation to use simplistic language. Okay, so if at all a staff is having a temptation to use simplistic language, they must avoid doing it. Okay, so these are the words over here, keywords, temptation and simplistic language. Now, in order to understand what it truly means, we really have to connect the question to the answer option so that we understand the story, and it will help us to find the answer a little bit more easily. So this is what option A truly means. When sharing troubling details with patients, staff should refrain from using overly simplistic language. Okay, so that is what option A truly means. Option B, directing their attention at family members. So together, combining the question to the answer option, what do we get? We understand when revealing upsetting news to patients, staff should not focus on family members. Okay. C option, any approach which leads to misunderstandings. Okay, so misunderstanding is the keyword over here. So combining the answer option to the question, what do we get? When sharing troubling information with patients, staff should prevent any methods that could cause misunderstandings. All right, so we have to register all these things into our memory. Now we have to go to the paragraph and let's read the paragraph that is given in your question paper. Extract from a manual on surgery. Disclosure. The delivery of bad news is very difficult. Arrange to talk to the patient in the company of family, preferably away from other patients. In some cultures, it is not common to give difficult news directly to the patient. We must be aware that the norms and customs of our patients may not match our own. Often, we try to soften the delivery of bad news by saying too much and confusing the matter, or by saying too little and leaving people with unanswered questions. Do not say neoplasm if what you mean and what will be understood is cancer. Be clear. Allow people to understand and feel some of the impact of the news, and then allow them to ask questions. It is often necessary to repeat the information to other family members or to the same people the next day. Okay, so that is the OET text. Now we are supposed to understand that little bit more clearly. So if you notice, the complex sentences are abundant when it comes to the OET reading passages. So therefore, to help us teach you better, we have converted them into simple English point by point so that you can grasp the content more easily. So let's understand this in simple English. Sharing bad news is hard. When you have to tell a patient something tough, it's best to do it with their family around and away from other patients. In some cultures, it is not common to tell the patient directly. People's customs may be different from ours, and we have to be sensitive to that. Sometimes we make things more complicated by saying too much or too little, which confuses people. Instead of using complicated medical terms like neoplasm, use simple words like cancer. Be clear. Let people understand the news and let them ask questions. You might need to repeat the information to family members or the same people the next day. Okay, so this is what it means. So we have understood that. So if at all you require more time, just pause the video and go through them until you understand everything more clearly. So here you may go through the translations if at all, if it is applicable to you. Further languages will be coming along. Now, what is the answer to the very first question? When disclosing distressing information to patients, staff must avoid. And the correct answer option is C, any approach which leads to misunderstandings. Okay, so C is the correct answer. And let me explain to you why C is the correct answer. The answer, any approach which leads to misunderstandings, is justified by the paragraph's emphasis on the importance of clear and effective communication when delivering distressing news to patients. The passage suggests that staff should avoid saying too much or too little, as both can lead to confusion and unanswered questions. It stresses the need for clarity and allowing patients to understand and feel the impact of the news, which helps in avoiding misunderstandings. Furthermore, the passage highlights the importance of considering the cultural norms and customs of patients to ensure effective communication and minimize any potential misunderstandings during the disclosure of distressing information. All right, so this is the reason why answer option C is the correct answer option. Okay, so if you need more time, just pause the video and go through them because everything has been clearly and neatly explained to you. It should not be that difficult. Now, let's understand why each of the other answer options are wrong. So answer option A is incorrect. The temptation to use simplistic language. So let's understand why this is wrong. This answer is incorrect because the text does not specifically warn against the use of simplistic language. It advises being clear and avoiding unnecessary complexity or confusion when delivering bad news. It does not mean that using simplistic language is inherently wrong. The key point is to ensure clarity and understanding, which may or may not involve using simple language depending on the situation. Okay, so that is the reason why answer option A is the wrong answer option. Okay, so now you have understood that. Let's understand why answer option B is also wrong and thus eliminated. Directing their attention at family members. This answer is incorrect because the text actually suggests that when delivering bad news, it is advisable to talk to the patient in the company of family, preferably away from other patients. In some cases, involving family members can provide emotional support and help the patient better understand and cope with the situation. So, directing attention at family members is not something staff should avoid, but it's recommended in certain situations. Okay, so for that particular reason, we can eliminate answer option that as well.